Thank you. It's good to be among friendlies for a change. So here's a little brochure. It's different from my last talk. It's about the abortion breast cancer link. Gives you a little detail that I might be going kind of fast with some of my slides because I have too many. But this is a talk that's kind of based on a book that I co-authored with two people from the De Weber Institute in Toronto. And they had a 2003 edition of the book called, can't remember the name of it, The Medical and Psychological Impact of Abortion on Women. And the data that they had in the book on the ABC link was very old, and it needed updating. And I said, look, if you're going to make a new edition, put this in. And then I ended up doing a lot more. But so all of this information will be in this book that I'm talking about. I think a lot of people sign up for having an abortion because if they really knew all of the effects of abortion, it would be less appealing. So there are some women that are going to say, nope, it's my kid and it's my child and it's a human and I'm not going to have an abortion. And other people have to understand why it's not going to be too good for them either. So this is what if all the women knew all of the facts. So when you're talking about a subject like this, the ABC link in particular, first they ignore you, then they laugh at you. I have a lot of that. They make fun of you all the time in papers. I'm sure they make fun of you too if you ever bring up the subject. And then they fight you. I think we're in a pretty good position right now because there's a lot of pushback. So they are paying attention and they are just not ignoring it. And then you win. And so it was Mahatma Gandhi that said that. So we're in a period of time where there's a lot of pushback, and before they just used to ignore it and say that you were idiots. So now you just need the data so that when somebody says, I was on the plane coming from Newark last night, and most people don't talk to you on a plane. You just want to. But I was on the window, and there was this woman in the middle seat, and she says to me, oh, so why are you going to Portland? I said, I'm going to speak at a conference. And she said, oh, what conference? Oregon Right to Life. Well, that was like 2.5 hours of abortion stuff. And so I think that and we talked about some of the things. And one of the things she said to me was, well, it's safer to have an abortion than to give birth. And I think most people in the room would know that that wasn't true. And so, but you need to have the data to say, this is how come we know it isn't true. And that's what I'd like to give you today. So women need facts before they make a choice. This isn't a clump of tissue. But what about the lesser known facts? Facts that they need when they make informed consent. So what is informed consent? There's a medical definition of an agreement the patient signs to give permission for treatment. And the only time that you can get that is when the patient really knows what they're getting into and the risks and the benefits. And then there's a legal definition of informed consent, and it's really different in every state. It has to be a voluntary agreement. Now, if we know from research data that 67% of women will say, yeah, they felt coerced. They were between a rock and a hard place. If they didn't have that abortion, they might be, have some violence committed on them by their intimate partner, or they wouldn't have support. The rug was going to get pulled out from under them. Their family was going to kick them out. They wouldn't have a way to make a living. So it has to be voluntary, and if you're under any kind of coercion, whether it's emotional, I'm going to break up with you if you don't, physical, I'm throwing you down a flight of concrete stairs like one of my patients told me, then you're not having informed consent. You're under coercion. And then you have to have sufficient mental capacity. Now, no offense to the younger people in this room, but your brain doesn't fully mature until you're in your 20s. That's why you can't rent a car until you're 25. Because, you can be a perfectly fine person and be intelligent and decide that you're going to take that rental car and go 100 miles down the freeway, 100 miles an hour. So think of how many abortions are done on teenagers and women in their early 20s. Can they actually think down the line about these other implications? And so I don't think we meet that when it comes to abortion consents a lot of the time. And then there's the Hippocratic, that's Hippocrates there in that little picture, where the ethical principles of informed consent are built on the principles of autonomy, that the patient should be the one that decides on what treatment to have. Not, I was in the 70s when I would be doing histories and physicals on patients Friday night for their Saturday morning abortion in the hospital. I talked to a woman that was in her, she was probably in her 30s. And I said to her, just as part of the history, have you ever had an abortion before? And she said, yes. And I said, when was it? Meaning the date. And she said, well, let me think. He would have been 5 in August. So I went to the OB and I said, I don't know if you should be doing this. And I asked her, well, why are you having it? And she said, well, my mother-in-law and all these other things. So she didn't have that autonomy. That was pressure and taken away from her. So that's the ethical definition. So basically you need 7 things. Competence. So you have to have a good developed brain. You can't be 13 years old going for a second trimester abortion like you can in the state of New Jersey. It has to be voluntary, and we know that it has to be free of, it's not if you're being coerced. You have to have disclosed to you what we know about it. And certainly they don't go through the literature about, the psychological effects and the physical effects. And there has to be comprehension. It's not good enough to say to a patient, you can have this, this, and this, and this, 4 things. And then when you say to them, well, what did I just say to you? They can't repeat it back. They don't know what it is. They have to comprehend it. And they have to make the decision, and then they have to say, yes, go ahead and do it. So that's what informed consent is. And part of informed consent is being able to say, now that you told me that if I have this operation, I'd be at higher risk for X, Y, and Z. No, something I don't think I want to have that. You have to have that. How many people go into an abortion clinic and the staff there says, yeah, it could be risky for you, maybe it's a late term or something like that. So you need all the facts to have informed consent, and clearly we don't have that when it comes to the majority of the abortions that are done in this country. So what are the facts about choice, about induced abortion, and what do you need for informed consent? How do you get that information? Because every woman has the right to know these things. Isn't that part of social justice? We can pick that one up. We need to have good informed legal consent because we know all the facts. So I'm going to talk about this book now. I'll do a financial disclosure. I was a voluntary author, which means I didn't get paid. I don't have any royalties. It's not going to make a bit of difference. We don't sell them, but the Developer Institute does. And there's really something in this book for everyone. So this is the book. It's called Complications: Abortion's Impact on Women. And we arranged it so you don't have to read it front to back. So there are 4 sections. The first one is the big picture, things like demographics and, that happen with sex selection, things like that. Then the biggest section is the medical impact. Then there's a 3rd section on the psychological and social impact, and a 4th section on what is the woman's experience with abortion. Not only the data that's collected on them when you say, well, how do you feel now? But them explaining that process in their own words. So before each section, there's a summary of what's in the chapter. And each chapter is summarized on the first page of that chapter with the key points. And there's a glossary, because a lot, there's words like amniotic fluid or Mobius syndrome and things like that. So there's a way to look up the words you don't understand. And there are 668 fully cited references. So that when you go to write a letter to the editor and you say, no, that isn't true, you can look up the fact that you want, go to the reference section and say, so-and-so wrote a paper, and this year, in this journal, and this is what it said. Don't you think you have a right to know about that? Good for letters to the editor. And then an index. I've used it myself. Like, I couldn't remember the name of the bacteria that you get when you use U486. It's a Clostridia. Couldn't think of the type of Clostridia. I actually looked it up, so it works. So, who can use this book? Pregnancy resource centers, sidewalk counselors, legal groups, medical groups, legislative groups, because you want legislation to say very effective is the right to know laws, and grassroots organizations. And so now I'm going to give you examples. Okay, so we need facts to combat the myth. So this is a myth. Abortion is needed to improve maternal mortality in third world countries. Don't you hear that? I mean, at the UN, abortion for everyone. That's part of maternal health. So what do? You look up in the big picture, chapter 2, and look at what it says. Countries that have disallowed abortion, Chile, El Salvador, Nicaragua, Egypt, and Uganda, have seen reductions in maternal mortality, while the countries that legalized it, like South Africa and Guyana, haven't seen any benefit. So the way to really reduce maternal mortality is to have skilled attendants at birth and get these women to clinics. So a lot of times if they're in the bush in Africa, they don't have the transportation to get them the 10 miles to the medical clinic while they're pregnant. Those are the things that will really reduce maternal mortality. Being pro-choice is being pro-woman? Not. So what about abortion and sex selection? So an unforeseen consequence of a woman's right to choose has been the international death of millions of women. And so isn't that sex selection something that shows prejudice against women? So how could you possibly be for something where in India sex selection is used a lot, and then of course in China, because of their one-child policy, it's used a lot? Then this is my fave. Abortion does not cause breast cancer. So this is the longest chapter in the book. It's like over 30 pages, but it's written in a very, I think, or tried to make it very simple way to understand it. And it talks about the biology and the epidemiology of the abortion breast cancer link, but it also talks about the social and political pressures suppressing the information. Before I get into this at all, I want to say that most women with breast cancer have not had an abortion, and most women with an abortion won't get breast cancer, just like most women who smoke won't get lung cancer, but we still tell them it isn't a good idea. We educate them about their risks. So we've known about the protective effect of a full-term pregnancy since the Middle Ages, when it was noted that only nuns were getting breast cancer, because largely they were childless. And everybody else was Romeo and Juliet, getting married in their teens and having children. The first study was done in 1743 that showed a protective effect of having a pregnancy. And today, now we know the molecular basis of why that would be true. So cancers start in some of breast cancers start in stem cells. And we know that having a full-term pregnancy reduces the number of breast stem cells where cancers start. So now they're trying to do a blood test where they could identify how many stem cells you have in your breast. So women who've had children have fewer stem cells, fewer places for cancers to start. Now, I'm going to talk to you about, you know how people get into arguments about studies? Well, this study showed this. And Disraeli said that there were 3 types of lies: lies, damnable lies, and statistics. So basically, you can find subsets of women in any study to show anything you kind of want to do. And it's very easy now because they have all of these computer programs where you're just hitting some buttons and pulling out the women. Well, if we looked at women between 23 and 34, and they were this, genetically, then we could show this. You can pretty much do that. But you can't change basic facts that we know about our human breast biology. So these are things that nobody disagrees upon. A full-term pregnancy lowers a woman's risk of breast cancer. Known that in a study since 1743. And each additional pregnancy after that first one lowers that woman's risk another 10%. For each year a woman delays a pregnancy after the age of 20, she increases her risk of breast cancer 5% per year for premenopausal breast cancer. So, I'm almost Medicare age, another couple of months. And my mother's generation, you went to high school, maybe college, and you got married and you had kids. And a lot of people were getting married at 19 and stuff. It wasn't really abnormal. But, now women are waiting till their 30s or maybe 41 like I was to have their first pregnancy. And so that does increase breast cancer risk. So that's not a disputable fact. And then we know that premature birth before 32 weeks doubles breast cancer risk. And nobody disagrees about that. So if you take those 4 facts, you can show that a woman who's pregnant, because abortion doesn't make you unpregnant, it ends the pregnancy, but you've been pregnant and you've had changes to your breast and your body during that time before the abortion. So any woman who's been pregnant, who ends the pregnancy through an abortion, she will increase her risk of breast cancer. So you have that woman that shows up at a pregnancy resource center, and if she chooses to have that child, she will, if she gets to have a pregnancy that lasts beyond 32 weeks, she will have a lower risk of breast cancer. No doubt about that. So if she decides to end that pregnancy with an induced abortion, she'll necessarily have an increased risk because She loses the benefit of a full-term pregnancy, and she will necessarily delay her next pregnancy. She's 16 and having an abortion. And she goes to school and she gets married and she has her kid at 30. Well, that's 5% per year. She's increased her risk. Or maybe she'll be unlucky and something will make her infertile. Or maybe she'll just choose never to have children and she remains nulliparous without children. That is a risk factor for breast cancer. Or during the abortion, because the cervix is instrumented, she could have a damaged cervix. So everybody who's given birth knows that it takes hours and hours, hours and hours and hours to dilate that cervix, to get it wide enough and thin enough to get a head through. So if you do any instrumentation, even if you just have a D&C because you had a spontaneous abortion and you lost the fetal heart, that increases your risk of premature birth. Now, there's something called the independent link. Is there something in and of itself about induced abortion that will increase a woman's breast cancer risk? And that's what the studies, the epidemiologic studies, try to figure out. And there is. Since 1957 to the end of 2013, there were 72 studies that differentiated between induced and spontaneous abortion. And of those 72, 55 showed an association that more women with abortions got breast cancer than the women who didn't. And of those 55, 33 were statistically significant, meaning the results of those studies couldn't have been done through chance alone with 95% certainty. So there's a lot of data that does back this up. So what is it about having a full-term pregnancy and not having having an abortion that would increase your risk? It has to do with breast maturation. So before a full-term pregnancy, you have breast tissue, but it looks like the one in the first two boxes. It's not as well developed. But after a full-term pregnancy, when it's gotten after 32 weeks where you've made some colostrum, made some milk, then you've had enough cells or lobules change with the genetic effects that you get from them, what genes are turned on and turned off, so that they become resistant to breast cancer in your entire life. So what happens during pregnancy? The first half of pregnancy is 40 weeks, so now you know that the gynecologists and obstetricians have lied to you. They say you're pregnant 9 months. When is 40 weeks? 9 months. You're pregnant longer than that. So the first half, the first 20 weeks, your breasts get big. So like the late Robin Williams said, as soon as his wife gets pregnant, the breast fairy visits. When that embryo is floating down the fallopian tube before implantation, it's secreting human chorionic gonadotropin, which is stimulating the mother's ovaries to produce estrogen and progesterone, which stimulates breast tissue to grow. So it's proliferating. And then at the second half, you differentiate it. You turn those undifferentiated breast cells into ones that are capable of producing milk. So this is just what they look like schematically. Type 1 is very rudimentary with about 11 ductules per lobular unit. The ductules are what becomes the glands that make the milk. Type 2, 47, type 3, 80. Type 4 are the ones that have the milk. So during your menstrual cycles, you develop more and more breast tissue, but it's only type 1 and 2, and it's only after you become pregnant that you get the more mature cancer-resistant ones. And why is that important? Well, type 1 lobules are where 85% of all breast cancers start. and those are ductal cancers. They arise in the milk duct. 10 to 15% arise in the milk glands that make the milk. Those are lobular cancers. But type 3 lobules, the 4s that had the milk that after you weaned or never breastfed regress to type 3 because they don't have the milk in them anymore, those are forever changed and they're cancer resistant. Cancers don't form in those. Now, you can understand that when your breasts are stimulated to grow, and they grow quickly, and when you're replicating those cells, every time you divide a cell, you have to copy the DNA. And if you're doing that quickly, you can form mutations, and if you have enough mutations or get a critical mutation, you can form a cancer. So it's a dangerous time for your breasts. You can make mutations, you can make a cancer cell. So how fearfully and wonderfully we're made. HCG also stimulates the mother's ovaries to produce a protein called inhibin. And inhibin is a tumor suppressor protein because it allows your body to fix any mutations, any mistakes that you made when you were copying them, so the mutations don't go through. So this is it in a nutshell. So people who like bar graphs can look at this. Before a full-term pregnancy, about 75% of your breast tissue is type 1 lobules, where ductal cancers start. About 25% are type 2, where lobular cancers start. But after a full-term pregnancy, about 70 to 90%, on the average 85% of your breast tissue has become type 3. And those don't form cancers. So if you want to look at that in a picture form, it's like this. You go through puberty. You got some breast tissue. You don't have a whole hell of a lot. Most of that mound that you see in the breast is due to fat and connective tissue, not so much glandular tissue and ducts. So after puberty, before first full-term pregnancy, about 75% of your breast is type 1 lobules, where ductal cancers start, 25% type 2. You get pregnant, the breast fairy visits, and then your breasts get really big. They start doubling in volume. But what do they make for you? More of the type 1 and 2s, where cancers start. So you've got more places for cancers to start. And then you get to the end of the 3rd trimester. And what do you have? 85% of your breast tissue has lobules that contain colostrum. They're type 4. They contain the early milk. The genes in their nuclei have been turned off and on. So for instance, in type 1 and 2 lobules, there are a lot of estrogen and progesterone receptors. So they're very reactive to hormone levels. In the type 3, there are very few. Type 3 and 4 lobules, there's very few, so they're not so sensitive. So now most of your breast tissue is cancer resistant. And after weaning, when the type 4s lose their milk, they're called type 3s. Okay? So that is the basis of the independent link between abortion and breast cancer. So after an induced abortion, there's more breast tissue where cancers can start. And you would think that, just thinking about it logically, if your breasts are growing up until 20 weeks, the longer you waited to have the abortion, the more likely you would be to have more tissue and more places for cancers to start, and your risk would be higher. And in fact, that is true. It's about a 3% increased risk of breast cancer for each week's gestation. So think about this. You have a teenager. A lot of times they have irregular periods, and they're in denial, and they're late, they miss a period. They're not thinking too much about it, but they are pregnant. And then another month goes by, and maybe they're just late, or maybe they missed a period. And they don't. So by the time they show up, when they start showing, they're in the second trimester. Worst time to have an abortion. And then you take them for an abortion because you don't want their life ruined and having a kid. So they have this abortion, and then they say, oh, that was very traumatic for you, and we don't want you to have to go through that again. So I know, we're going to give you the pill, a group 1 carcinogen for breast, cervical, and liver cancer. So then it's like kerosene onto a fire. Or if you're too frisky and they don't think they can get you to put a pill in your mouth every day, they capture you and they inject you with Depo-Provera, because they only have to do that every 3 months, and that doubles your breast cancer risk. So those teenagers are really abused, in my opinion. And Daling's study that you see on this slide, she found that teenagers 18 and under who got an abortion between 9 and 24 weeks had a 900% increased risk of breast cancer. And that's published in the Journal of the National Cancer Institute from 1994. What about spontaneous abortions? Because 23% of all conceptions that you know about, and about 33% of the conceptions that you don't know about, and you find out by doing blood tests, will spontaneously abort. Are they going to increase your risk? So this is a study from the 70s, and these women were in high-risk OB clinics, and they would come in spotting. And they would say, oh, am I going to miscarry? Am I going to lose the baby? And these 2 obstetricians, Kunz and Keller, did a simple thing. They drew a vial of blood and checked estrogen levels. And what they found was this. The estrogen levels is this black line, and it goes up all the way through pregnancy. So this is the number of weeks people are pregnant down here, up to 20 weeks. If their estrogen level was in the normal range, they would be all right. But if they were going to spontaneously abort, the estrogen levels were very low. So that's why spontaneous abortions in the first trimester do not increase your risk for breast cancer, because nothing has changed. Your estrogen, progesterone levels didn't go up, your breast didn't develop, you don't have more places for cancers to start. So that's the big difference between induced and spontaneous abortions. So if you want more information on it, you can go to our website, bcpinstitute.org, and you can download all the brochures and all our stuff for free, the booklet, everything free. And there are also published papers that you can take to your doctor. I recently wrote this paper. It's 133 pages long. It's got 205 references, and it's been out there. It's getting on to be a year, and nobody's written in a letter to the editor saying, no, this was wrong, this isn't a proper conclusion, and it's got a lot of good stuff in it. So what about this myth? Good prenatal care always requires prenatal testing. Well, you can go to prenatal testing and abortion for fetal abnormality. Now, this is a lot of times the prenatal tests are done so that you can tell a woman, your kid has a genetic defect, do you still want to have it, And Downs, 90% of the Downs babies don't get born anymore. And sometimes women are when you're pregnant, your IQ drops. I know it's true. It's like, mine went down a lot. And so for me, I was 41, and so the OB said to me, oh, well, you'll have to have some genetic testing. And I said, now look, I'm not going to kill it if it's stupid or ugly. So, why am I going to do that? Well, you could plan. I said, what? I'm not going to start a college fund? What am I going to plan? So a lot of times women are coerced into kind of things like that. But women have also expressed that when they've found these things out, they're only getting the negatives thing. That like how bad it'll be and how terrible the kid would be and everything like that. And very little emphasis was placed on the benefits of a disabled child, or that the disabled child wouldn't be, this awful burden that would ruin the woman's life. The woman I sat next to on the plane had a daughter with a genetic defect, and she said, I think women, abortion should always be legalized because women should always have that choice, and women shouldn't have to have, be forced to have disabled children, that they'd have to take care of the rest of their lives, and on and on and on. And then about 2 hours into this conversation, she starts showing me pictures of her daughter. It looks perfectly normal. She's does something with the Episcopal Church, and she's in the choir, and I said, she looks great. She has a boyfriend. Her deficit was that she couldn't do abstract reasoning. I said, what is that? She said, algebra and things like that, but her verbal scores are high. So, I don't know. So, one study that found that 28% overall women who had abortions because there was a fetal abnormality detected, 28% of them were depressed. And then in a group of chain of Catholic hospitals in this area, Washington and Oregon, I don't know, I don't want to say the name because I can't remember. If they detect a woman with an anencephalic infant, they say, there's no brain, the kid is going to die very soon after birth, and we're Catholic, so of course we can't do abortions, but you don't have to go through 9 months. We can induce labor at 26 weeks because that's the point of viability. And what happens, happens. But then they rob that woman of the breast reduction in breast cancer risk by carrying the child to 32. It's like crazy. So the better alternative would be to allow these hospitals to have something called perinatal hospice, where the family gets to be with the child for as long as they live, and the siblings who know that the mother's pregnant, they're expecting a brother or sister to come home. What happened to them? They disappeared. Just like the people in Argentina. They're gone. What happened? You get to say goodbye. You get to see them. So that's a better thing. And then they don't, I was at a conference, and there was this Irish, he practices in America, but he's Irish. His name is Paddy something, and he's got a brogue. But what they found was that women who weren't able to metabolize vitamin B6 well were having higher risks of Down's babies. And they knew this was true in mice experimentally. And so he decided, anybody that, had that risk or had the actual genetic defect on amnio of Down syndrome was going to get a lot of vitamin B. I think it was B6, 12. And then some of the kids are born, not only don't they look like Down syndrome with this face, but mentally they're normal. Their brain is functioning. So there are some forms of vitamin B that won't get across the blood-brain barrier until they've been metabolized they've had a couple of metabolic steps to put them in a form that can get through the blood-brain barrier. So why aren't we doing that? Why aren't doctors telling women, hey, there's some studies that show the B vitamins? And then it's also shown that the kids with the Downs do the same thing their mothers did and not metabolize it as well. And giving them more B vitamins helps them. So if the abortion occurs before 32 weeks, the mother will increase her risk of breast cancer. If you have a fetus with a defect not compatible with life, do perinatal hospice. Not only does she have a lower risk of breast cancer, but she'll have a lower risk of post-traumatic stress and depression. So you don't have to have invasive prenatal testing to be a good mother. If you aren't doing the prenatal testing to give therapy to the kid, like find a diaphragmatic hernia that you'll try to operate on in utero. So why is it that the default position is always terminate and try again? And I think a lot of that has to do with our malpractice. Because if somebody asked me when I was just starting this talk, so how do your colleagues like you? So I said, not too much. So I always give them literature. I was giving them literature. And then I got on the phone one time with this doctor that I'd given literature to. And he said, look, you don't have to do that anymore. I don't do abortions anymore. He goes, abortions was the worst thing that ever happened to OBGYNs because now everybody expects a perfect baby. And if you don't deliver a perfect baby, it's your fault. And your malpractice carrier's on the hook for lifetime care. So it's easier to say, try again, terminate, than it is to take that chance. Okay, so what about this myth? You can always have another baby when the time is right for you. You know, you're 16, you're 18, you want to go to college, have an abortion. So you look up, what are some of the physical complications? Well, one of them is infertility. And so women who have abortions are always in good, if there is a good abortion clinic, give women antibiotics to take because they do have a higher chance of becoming infertile because they get these pelvic infections afterwards. And one of the residents in my hospital had an abortion, and she said to me that she was pressured by her boyfriend. You know, if it was up to her, they would have just moved up the marriage, but he pressured her and she went along with it. And she said she took the prescription and she threw it out because she was hoping she did get an infection and she was hoping she would die. And this was somebody that had gone to Harvard for medical school. She was very smart, but so it can give you chronic pelvic pain, subfertility, infertility, increases your risk of ectopic pregnancies, which are life-threatening. Okay? And like one study from England showed a 620% increased risk in low fertility if you've had an abortion. And you could see why. I mean, Gosnell's clinic wasn't too clean. But, they're hiring high schoolers to give counseling. I mean, I don't know what level of their nursing care in terms of sterilizing the instruments between cases is. So PID, pelvic inflammatory disease, is very common after induced abortion. Okay, this is the one that I probably have to end on. Abortion is safer than childbirth. Not. Okay, so we come to physical complications. Now, they say that it's safer to have an abortion because the risk of dying from a first trimester abortion is so low. And how do they decide that? Well, they do use medical records. But if most of the abortions are outpatient clinics. You come into the hospital with a bad pelvic infection and you die, your death certificate will usually say sepsis, not abortion caused sepsis. So you're not counting those deaths. So it's very underreported, as you well know. So what's a good endpoint in terms of whether you're going to live or die? The best endpoint is death. So let's look at data that uses death as an endpoint. So they actually did that in Finland with the Gisler study. And what she did was she went to the death records and picked out all of the women who died between 15 and 45. And then, because they're a small socialized medicine country, she went to the records of the women that were pregnant in those same ages the year before. And then she got that group of women. And then she looked at, how did that pregnancy end? Did it end in birth, miscarriage, or abortion? And she saw who was more likely to be alive at the end of the year. And they found that women who had an abortion were much more likely to be dead than women who had a child. And then they started trying to tease out, well, why would that be? Well, maybe women who were mothers were less risk-taking. You know, they weren't driving their cars fast and going to the bar, drinking late at night and getting in their car and having accidents, because the accident rate was higher in women who were aborted. Or maybe some of those accidents were really suicide attempts from the post-traumatic stress they get. So those studies were duplicated in Denmark, and they're very friendly towards abortion, in Britain, and also in the United States. So how did they do that study in the United States? Well, they took Medi-Cal data. So in Medicaid, which is a federal program to give health insurance to poor people below the poverty level, in California it's called Medi-Cal, and all their records are computerized. So that, to me, is the best data that shows you're more likely to be alive if you give birth than you are to if you have an abortion. And I guess one more. Should I stop here? Okay, I'll do one more. Okay, then a lot of the abortions now are being done with RU486, which is blocks progesterone receptors. And it's supposed to be, you take a pill, it's very private, you go home. Well, what they don't understand is they're going to go in the labor and they're going to expel their child. And sometimes they are going to be able to see that child. So the failure rate, like I gave you the pills like I should, which includes the, besides the mifepristone, which is the RU486, the mistoprolol, which is the cytotec that causes the uterus to contract and expel the dead kid, doesn't work 4 to 16% of the time. 2% bleed so much that they require transfusion. There are deaths like Holly Patterson, that girl from California who died after RU486 from Clostridia sordelli infections. And then there's the Mobius syndrome in the infants that survive that attempt on their life. So it's not safe. If she starts labor, she might need a transfusion. And up to 16% in studies have to have their abortion completed by surgery. And sometimes, because the abortion clinic does maybe an HCG test to see that she's pregnant, they don't do an ultrasound, or they do a lousy ultrasound and they don't recognize she has an ectopic pregnancy, and they give her RU486, that woman can bleed to death from a ruptured ectopic that was not diagnosed. So it's definitely not safe. It's traumatic for women. Does everybody know about that book called Unprotected? Have any of you heard about it? I recommend this book to be given to every kid who's going to go to college. Although my husband was really mad at me. So there's this little book. It's about this thick, and about this big, called Unprotected. When it first came out, it was written by Anonymous, but now it's Miriam Grossman, and she was a psychiatrist that worked at student health at UCLA. And she has about 9 vignettes of students that she saw. And one of the students was a student that had gotten RU-486 and ended up delivering in the dorm, and a fetus comes out, and what do? You put it in a shoebox? Do you try to flush it down the toilet? I mean, what do? It's like very traumatic thing. So it's a very informative book, and I think it's really good for, college level kids to know about. So premature birth is really, really bad in this country. 12.5% of all births now are premature before 37 weeks. Full term is 40. In blacks, it's 17.5%, because even though they're 11% of the population, they account for about 38% of all the abortions. So they have a much higher rate of prematurity. Before 32 weeks, you increase your risk of breast cancer, and you also have the child have cerebral palsy, autism, epilepsy, and increased mortality. So it's not a good one. And we're done. Okay. All right. So anyway, I encourage you to get that book, because I think it'll be a very good resource for you.